Okay, good morning. It's Wednesday. I have questions today from people about hormone replacement therapy and bleeding. So any post-menopause bleeding has to be investigated. So if we have a full year, let's just say I had one client, for example, who finished everything through her whole perimenopause. She was fine. Really no troubling symptoms at all. But then after she got through her full year of no period, she started to have really a lot of discomfort and came to me, and we worked her through it. And she worked with a nurse practitioner to prescribe hormones. Um, and really, she needed estrogen. So I'm just looking up. This is one of the books that I love, The Galveston Diet. I did a book study about this book a couple of years ago in the summer, and I got a lot of negative feedback. There's a lot of the word diet is very triggering for a lot of people. I realized I did not know that because I've luckily never really done a lot of dieting, although I have had food issues when I was younger. So basically, what she's saying here about estrogen, it's an umbrella term for three chemically similar hormones: estrone, estradiol, estroil. I'm terrible with words. I'm dyslexic, so pronunciation and weird spellings and words that are not English are very difficult for me. So estradiol is what we usually end up in our prescriptions. Um, it allows body fat to be distributed on the thighs, buttocks, and abdomen, and additional fat deposits provide energy source for eventual pregnancy and lactation. And then here are the benefits. For example, bones and maintaining your bone strength, helps control cholesterol levels, increases blood supply to skin, regulates thickness of skin, helps pelvic floor and vaginal bladder tissue strong and healthy, and can even help with moods and manage anxiety and depression. So the reason why we can't say yes, HRT is just safe for everybody is because everybody's a little bit different. Like right now, I've had estrogen dominance. If you were to give me more estrogen, I would feel better in some ways and worse in others. And it can be a problem for you if you have too much estrogen with breast health. So I'm just looking to see, she's got some good suggestions about managing estrogen through your diet. This is a book all about what you're eating. She brings up a lot of stuff like supplementing with magnesium and how effective that is. Basically, the idea is sometimes for some people who start using HRT, they can have bleeding start again because they're adding in estrogen. You do have to get it checked if it's been over a year. If it's any change, new or worsening symptoms, you really need to get that looked at as well. I have this whole section blocked off here. Sometimes I do that when it's like a subject area where I'll just put a little tag there so it gets flagged. She does say that hormones do concern our weight and concentrate on changing the patterns of your eating, take control over it. The field of hormone replacement is here to stay. It can be life-changing. It redistributes your body fat so you have a little bit more proportion, right? So it's not just stuck on your belly. Yeah, so all of those great suggestions in here. I'm just looking to see if she says anything in particular exactly about bleeding. I know that it's pretty common. So if that's you, if you started taking hormones and you started bleeding again, one thing that you can look at is your estrogen. How much estrogen are you taking? And is it too much? She has a lot of resources, but she's American, so they don't necessarily work for us. You must not take estrogen alone if you have a uterus due to risk of endometrial cancer. So basically, the hormones are doing their little dance. The estrogen peaks when you ovulate, and then it starts to drop down again. And the progesterone keeps the uterus nice and squishy and healthy so that the egg can implant in the side of the uterus. So they really work together, those two things. She didn't specifically say anything about bleeding, and that's what I find a lot. Like I have several books. This one is a good one to definitely check out if you're worried about weight gain. I just talked to someone this week that was really worried about that. This one is my favorite. This is the teacher that I worked with, Dr. Sarah Gottfried. She's now gone back to her maiden name, Sizal. So let's see what she says about bleeding. She's definitely a big proponent on doing all of the natural stuff first and then adding in hormone replacement. She's got a lot of quizzes in here that are very, very helpful. Heavy periods, PMS, insomnia, and infertility. So she's linking a lot of this to low progesterone. That's why, in her opinion, a lot of us end up starting with progesterone way before we would start with estrogen. Combined with estrogen, progesterone is responsible for making your uterine lining into a super thick shag carpet for the fertilized nest to nestle in and grow. Progesterone is also released to support the fetus and promote breastfeeding. Pregnant or not, hormones swim through your blood toward particular cells seeking to bind with receptors. So that's the argument about bioidentical. It's because the receptor sites are the same shape as the plant-based hormone, and it's easier for them to attach. So that's why she is a proponent of using bioidentical, but in the meantime, the prescriptions have caught up. So again, I'm not seeing anything particular about bleeding. So I think that's basically the gist of it. I have one more book that I want to check and just see if she says anything about bleeding. Hang on, I just feel like we're just on to something. Okay. Okay. So this was all about progesterone. She's got balance sheets. It's really good to work on that stuff. For bioidentical, make sure your doctor prescribes bioidentical progesterone, not progestins, although I'm taking progestin to stop my period, which has been amazing for me. It's been great. So estrogen dominance, see, she talks about all this good stuff, even though this is a little bit of an older book. Okay, so after menopause, women make estrogen mostly in the fat tissues. Overweight or obese women have more fat cells than lean women, so they produce more estrogen. So basically, that's what your belly is trying to do. It's trying to help you. She does have some stuff on diet. Again, they're against alcohol. Alcohol can make everything more difficult. But nothing specifically about bleeding and being on HRT. This one is the newest book that I have. This one is this is Karen Tang, and it's 2024, I think. I just got it when it was brand new, and I love it. It's a great book to have for your own, like if you have any questions about your biology, where things are, what they do, how they work. She talks about all of the female anatomy in very specific terms. Oh, she even has Ehlers-Danlos syndrome, which is, kind of rare or rarer. Now I'm hearing more about it. I have two friends that have that, ironically. Okay, let me just see. She's got a lot about pap smears, so don't skip your pap smears. Yeah, I don't know if she says anything specifically about HRT. Isn't that weird, hey? Hormone replacement gender affirming is different than for menopause. Okay, let's just see what she's got here. 173. Okay, so treatments, hormonal medication, menopausal hormone therapy, MHT, we still call it HRT sometimes. Can be taken as a pill, topical gel, or spray, patch, contrasted vaginal estrogen treatments, cream, tablet, or ring. Very little to no hormone actually gets absorbed in the body through the vagina, but vaginal estrogen is considered a local treatment. It can be expensive to do hormone therapy. I'm just looking to see if she says something specifically about it. She's talking about the WHI results that were published, but that was actually a faulty study. The average age was 63. Like a 63-year-old woman who's never had hormone replacement therapy would have trouble getting that now. In order to minimize health risks, doctors may discuss trying to wean off hormones if symptoms are no longer present. It's no longer given to prevent osteoporosis and heart disease, prescribed only for treatment of symptoms that are affecting quality of life. So there you go. I'm not seeing anything here that's specific to bleeding post use of HRT, but this is just a really quick once over. I just want to make sure that you guys know what books I'm using so that you can reference those too, right? They're available. All of these books are available on Amazon. I like Thrift Book. I use this thrift bookstore online and I've been able to get all kinds of good stuff. So here's the gist of it. If you've added in HRT and you start to have a period, you need to report that to your prescribing doctor. Go and get checked. Make sure that everything's fine. They'll probably have an ultrasound. They might want to do a uterine biopsy. You can ask to have your estrogen reduced if you've started at a higher dosage. One option that I recently heard of was having an IUD inserted inside the vagina, or inside the uterus, so that you do not get any post HRT bleeding. Feel mixed about that. I think it would work. It would definitely, I know it would work. I couldn't handle the IUD though. It gave me too many problems. I could feel it all the time. So with that, I think I'm going to sign off and let me know if you have any questions. Thanks.